The year is 2025. We live in a time of incredible medical advancement, yet we are facing a challenge from the past, a measles outbreak. Measles is a highly contagious and potentially deadly disease. It was declared eliminated in the United States in 2000. However, declining vaccination rates have created a dangerous vulnerability. This vulnerability has led to the current outbreak, which is particularly severe in West Texas and New Mexico. This outbreak is a stark reminder of the importance of vaccination. Measles is not a harmless childhood illness. It can lead to serious complications, even death. The outbreak is a tragedy for those affected and a public health threat that demands immediate attention. We must act now to contain this outbreak and prevent future ones. This requires a multifaceted approach. We need to increase vaccination rates, educate the public about the risks of measles, and ensure access to healthcare for all. The time to act is now. We must work together to protect our communities from this preventable disease. The 2025 measles outbreak is concentrated in West Texas and New Mexico. As of March 12, 2025, there are over 250 confirmed cases in these areas. The majority of cases are in unvaccinated children. The outbreak began in Gaines County, Texas, in late January 2025. It quickly spread to neighboring counties. There have been 29 hospitalizations and 1 death in Texas. The death was an unvaccinated young child. The outbreak in New Mexico is centered in Lea County. This county borders Gaines County, Texas. While not officially confirmed, officials believe the outbreaks in Texas and New Mexico are connected. There has been 1 death in New Mexico, an unvaccinated individual who tested positive for measles. The outbreak has also reached Oklahoma, with 2 confirmed cases linked to the Texas-New Mexico cluster. Additionally, 12 other states have reported isolated cases, typically linked to international travel. This highlights the ease with which measles can spread in an under-vaccinated population. Low vaccination rates are at the heart of the 2025 measles outbreak. Gaines County, Texas, has historically low childhood vaccination rates. This is particularly true in the Mennonite community. The community has a tradition of avoiding healthcare systems. This has led to susceptibility to preventable diseases like measles. Texas law requires the MMR vaccine for school attendance. However, it allows exemptions for reasons of conscience. Gaines County has one of the highest exemption rates in Texas. The Loop Independent School District had the lowest measles vaccination rate. Only 46% of kindergartners were vaccinated in the 2023 to 2024 school year. These low vaccination rates created a perfect storm for the current outbreak. This highlights the critical need for increased vaccination efforts. Measles is often mistakenly perceived as a harmless childhood illness. However, it is a serious and potentially deadly disease. Measles is one of the most contagious infections known. It spreads through the air via coughing and sneezing. Infected individuals can spread the virus even before they develop symptoms. Symptoms of measles typically appear 7 to 14 days after exposure. They include fever, cough, runny nose, red eyes, and a rash. The rash usually starts on the face and spreads to the rest of the body. Measles can lead to serious complications, including pneumonia, which is an infection of the lungs, and encephalitis, which is swelling of the brain that can cause blindness, deafness, and intellectual disabilities. Tragically, 1 to 2 out of every 1,000 children with measles will die from complications. Furthermore, measles can cause immune amnesia. This weakens the immune system, making individuals more susceptible to other illnesses for months or even years after infection. This underscores the long-term health consequences of measles. The good news is that measles is preventable. The MMR vaccine is safe and highly effective. 2 doses of the vaccine are 97% effective at preventing measles infection. Vaccination not only protects individuals but also helps to achieve herd immunity. Herd immunity occurs when a significant portion of the population is immune to a disease, making it difficult for the disease to spread. This protects those who cannot be vaccinated, such as infants and individuals with certain medical conditions. The 2025 measles outbreak is a stark reminder of the importance of maintaining high vaccination rates. We must work to address vaccine hesitancy and misinformation. Everyone who can be vaccinated should get vaccinated. I urge you to check your vaccination status and that of your loved ones. If you are not vaccinated or are unsure of your vaccination history, please contact your healthcare provider. Vaccination is the best way to protect yourself, your family, and your community from measles. For more information about measles and vaccination, please visit the Centers for Disease Control and Prevention website at www.cdc.gov or the World Health Organization website at www.who.int.